17-year-old young man presented with history of recurrent left nasal bleeding and nasal obstruction. X-ray para-nasal sinus DID. It shows opacification in the sphenoid, left maxillary and left ethmoid sinuses. Non-contrast and contrast CT paranasal sinus are ordered by a surgeon for further evaluation. Positive findings are: there is a heterogeneously enhancing locally infiltrating soft tissue mass lesion filling the sphenoid sinus, demonstrated centered on the sphenopalatine foramen with widened foramen and bowing the posterior wall of the maxillary antrum anteriorly. Lesion extends anteriorly to the left maxillary sinus, middle nasal meatus and ethmoid sinews, causing obstruction. Lesion extends posteromedially into the left nasopharynx and laterally into the left pterygopalatine fossa. Nasal septum is deviated to the right side. Erosion of the clivus is seen. Pituitary fossa is eroded by the lesion extending superiorly. Post-contrast study shows marked contrast enhancement, reflecting the prominent vascularity. Negative findings are: no intralesional calcifications, no intracranial extension, no intraorbital extension. Bilateral frontal and right maxillary sinuses are normal. Both osteometal complexes are normal with no evidence of obstruction. Oropharynx and imaged parapharyngeal spaces are unremarkable. Visualized orbital cavity appears normal. Impression: a heterogeneously enhancing mass lesion centered on the sphenopalatine foramen with filling the sphenoid sinus and extending into the left maxillary sinus, middle nasal meatus, ethmoid sinuses and left nasopharynx. Possible juvenile angiofibroma, DD, rhabdomyosarcoma involving in the head and neck and nasopharyngeal carcinoma. Suggest MRI for evaluating tumor extension into the orbit and intracranial compartments and angiography, DSA. Discussion: juvenile nasopharyngeal angiofibromas are a rare benign, but locally aggressive, vascular tumors that occur almost exclusively in young men, usually between the ages of 10 and 18. Arises in the region of the sphenopalatine foramen and it grows insidiously invading surrounding structures. It presents commonly with nasal obstruction and recurrent epistaxis in young adolescent males. The nasopharynx is not easily accessible but has a high capacity, and as such tumors in this region tend to present late. Given its vascularity, prominent flow voids are seen on MRI leading to a salt and pepper appearance. Surgical resection, either open or endoscopic, is the treatment of choice, usually performed after preoperative embolization to help with hemostasis.